So welcome to open enrollment. Today we're going to go through your benefits. We're going to tell you how to get into Oracle, the steps, step by step, hopefully everything. The people who have tried it so far, it's pretty smooth. The yellow piece of paper that is at the back will give you step by step, but we also have a little video, which is kind of fun. So today we have Ken from USI, who's our broker. He will go through the other benefits. And Trina, who works for GHT, which is our new health insurance company for 2026. And she'll go through the neat things that GHT has to offer. So here you go, Ken.
Perfect, thanks. Afternoon, morning, everybody. Ken Zastra, USI Benefits Consultant. So as Mary said, I'm gonna go through all the benefits. I'm gonna talk about some ancillary voluntary benefits, dental, etc. again. But the big story is Trina Kiefer talking through a switch from Anthem to GHD Health Trust for insurance. So those of you that were maybe here, was it 3 years ago, maybe familiar with them as a provider. So we are going back there. She's gonna walk through what that looks like and all the value adds. So that's a big change on top of the Oracle piece that Mary mentioned, where everyone's gonna have to go through an active enrollment this year and elect benefits or waive benefits. It's not gonna be a status quo situation like it maybe was in the past. So we'll go through all these slides, answer any questions. We'll certainly be here at the end to answer any individual questions as well. So with that, Trina.
Thank you. Good morning. Welcome back, Fond du Lac County. We're super thrilled to have you back with the WCA Group Health Trust. It's fun going to a group and not having to ask how many of you have heard of GHT. I've been in meetings where we're not very familiar, but just to refresh you, if you are new, we do the Group Health Trust, who we are a jointly self-funded trust. We work with schools, counties, and municipalities within the state of Wisconsin. So in order to be part of the GHT, must be a public entity in Wisconsin. We work with about 15,000 employees and 40,000 members. So if you were with us before, our partners have not changed. We still work with United Healthcare, who provides our network access or our access to doctors. So we have the Choice Plus PPO network. It is a national provider network. So it includes all major provider systems in the state of Wisconsin, with the exception of Dean Health Plan doctors in the Madison area. So the SSM, the previous Indian providers, they are in the network. We just finished the contract with Ascension. You may have seen the news about that. So Ascension continues to be in our networks. Aurora, Theta, Prevea, depending on what part of the state you're, or what part of the area you're driving in from. So please look at your doctors. With the exception of Aurora, most of our doctors do contract at the individual level. So if you go to a doctor, you want to look for Dr. Smith, Dr. Jones, depending on the specialty. So you can go in today, check to see if your doctor's in network. If you need help with that, I'll be sharing some email addresses that you could reach out to us directly. I'll talk a little bit more about that at the end of the presentation. UMR is our third-party administrator, so they handle the day-to-day for us. So the claims processing, customer service, enrollment. So again, they handle a lot of that for us. If you get your ID card, you'll see UMR's logo on it. Your EOB's explanation of benefits, that will have the UMR logo. So again, they're our partner and our third-party administrator. And CVS Caremark is our pharmacy benefit manager. If you were on the plan when you had GHT before, that hasn't changed. You do not need to use a CVS pharmacy. All major pharmacies participate, and a lot of local pharmacies participate as well. So again, just that's who our partner is for the prescriptions. So you can look to see your providers now. As I mentioned, you can go up to umr.com and select United Healthcare Choice Plus Network through their dropdown. So you'll want to go to the letter U because they work with a lot of networks. And so when you use United Healthcare Choice Plus Network, you'll want to select Find a Provider. They do have a separate search for behavioral health providers. and then a separate search for national vendors, which are for durable medical equipment. So for example, if you are already on a CPAP and you need refills or supplies, then you'll want to look to see who is available for that provider to send you the durable medical equipment. But again, if you need help, we'll offer that help for you just by reaching out to our team. With United Healthcare Choice Plus Network, they do have premium designation, premium care providers listed by the 2 blue hearts. That's high quality, lower cost providers. You do not need to see a premium care physician. Just know that that's out there. And if you see the 2 blue hearts, that's what that means. And we will continue to use the Centers of Excellence for transplant care. So again, this is just showing you a map of the state. All major providers are in network. The only one that I can think of with the hospital is at SSM St. Mary's and Madison. They are not in the network. But again, you'll want to verify that. But again, Aurora, Freighter, Ascension, the Asian doctors, data on, so lots of provider access for you. So if you, by chance, saved your ID card from when you were with GHT before, you can throw that away. If you just shred it, you will be getting a new ID number. You'll need to recreate access to the UMR portal, which I strongly encourage you to do. This provides you a lot of great information. I often joke in these meetings that you'll get your bill from the doctor before you get your explanation of benefits to show that we processed the claim. So if you get your explanation of benefits, or if you need to look for your explanation of benefits, you can find that online. So through the UMR portal, once you get your ID card, you set up your account using your UMR ID number. You a lot of great information. You can see how much of your deductible has been applied, if the claim applied towards the copay. So just a lot of great information on there. The other thing I will say about that too is that it does show different tips and tricks and healthy information. So access to a lot of tools. One of the best things out here as well, as I said, you can go to umr.com to look for a doctor and you have to select the network, United Healthcare Choice Plus. If you set up a portal and you're looking for a doctor, it'll automatically identify you as an employee of Fond du Lac County, and it'll automatically take you to the Choice Plus network. So it's a great tool to actually look for doctors as well. So UMR customer service, the group health trust, all of our clients have access to plan advisor representatives, which are a higher trained, better quality provider customer service. So we implemented this a few years back where, again, all of our members have access to plan advisors. There's nothing special you have to do. The telephone number for the plan advisor team will be on the back of your ID card. They are available 7:30 to 5 Central Time, and they're located in the state of Wisconsin. Again, there's nothing special you need to do. We just like pointing it out because it's the service we believe our members deserve. So here's your benefit. You would have received electronically the paper packet. We did have limited supplies. I do have a few more if you absolutely need a paper packet, but these were emailed out to you. So the benefit summary design is in that packet of information. But you do have, I'm going to go through the in-network benefits, but $1,000 individual deductible. If you're on a family, that's $2,000. You pay 20% co-insurance. The plan pays 80%. The out-of-pocket maximum is $4,500 for single, $9,000 for family. And then deductible and co-insurance will apply to hospital services, inpatient, outpatient. For the office visit, it's a $25 copay, deductible, and co-insurance is waived. For office visits, specialist, chiropractic, physical occupational therapies, urgent care is a $40 copay, deductible, and co-insurance is waived. For emergency room care, that's a $150 copay, 80% co-insurance, so you pay 20%, the plan pays 80%. And then for behavioral health services, outpatient visit is $25. And then the rest of the services are subject to the deductible and 80% co-insurance, with the exception of preventive. Just want to point out with the preventive, through ACA, there's a number of preventive services that are paid at 100%. So if you go in for your annual exam, your annual wellness exam, and you tell them that you're there for your preventive exam, that would be at no cost to you. I'll go into a little bit more detail about Teladoc, but Teladoc is at no cost as well. So for the prescriptions, I will say that all health plan payers do have different formularies for their medication. So when you were with Group Health Trust, if you went on Porch, you would have had a different formulary, prescription drug formulary, for their primary or preferred medications. Same as that's different with Anthem, and so you may have some different prescription drugs that are on different tiered levels or require authorization. So I just like to point that out. That's standard in the industry. But for the Group Health Trust, you have the co-pays listed. I won't go over them specifically. I'll talk about the specialty medications through Prudent RX in just a minute. We are including a number of pretty good category of medications that are available at no cost. We call that our selective preventive list. So there are a number of medications that are available at no cost to you. And so the one thing I want to mention is I did say we will have access through those email addresses. If you want to know you're on a current medication, you've had to have a pre-authorization in the past, or you just want to know so you can plan what tier it is on, if it's a preferred medication, if it's a non-preferred medication, is there a more cost-effective medication available to you in that class of drugs? You can reach out to us now. And again, we'll list that email address. Just give us the name of the medication, what your dosage is, how often, the frequency of what you're taking that, and we can help you along with that. Again, we want to make sure this is a smooth transition. And because I'm saying that now, talking about prescriptions, I just want to remind you that if you do have a prescription that is available to be refilled like middle to late December, please get that medication refilled, because January 1st is a holiday with both. So I don't want someone standing at the pharmacy, if you even find one that's open, that on your last medication, on your last pill. So make sure that you get that pill so that you have some trends coming in, or make sure that you're reaching out to us so that we can, again, help you through that process of medication, because that is obviously the first day where there can tend to be a little bit of questions on that. So again, CVS Caremark is our partner. You do not need to use a CVS pharmacy. They do have an app. They have a website that you can access, great information. Again, all major chains are a network. As you can see from the previous slide, you have one level of prescription drug benefits. We just have everything that's subject to those co-pays, meaning you don't have in and out of network benefits for pharmacy. If it's a covered medication, it will fall along those tiers. So if you have a medication, you're out traveling and for whatever reason, they can't already, their system's down, you need to pick up that prescription, and you know it's a covered medication and you pay for that medication, you can submit it on a paper claim form and we'll process that claim. So there's not an in and out of network benefit. I just like to mention that. So Proven RX is a program that's available to you for specialty medication. So this is very important that you understand this, because Prudent RX offers you your specialty medications at no cost when you enroll in Prudent RX. So if you're on a specialty medication, you likely know that you're on a specialty medication. Again, the medication is to you at no cost. What's the gimmick? What's the catch? You have to enroll in Prudent RX. If you do not enroll in Prudent RX because you don't want to, there's a 30% penalty or co-insurance that you pay on that, but it does not apply towards your out-of-pocket maximum. So a lot of times we see with specialty medications, a lot of groups will have a higher cost share for those specialty medications because they cost a lot of money. So a lot of our plans will have like a 25% up to $250. So you could theoretically be paying $250 a month for those specialty medications. Through Prudent RX, because of the way the program works, we can give you that medication at no cost, but you have to enroll in the program. You will have a Prudent RX person reach out to you or your family member, if they're covered under the plan and you're on a specialty medication, I think it's about 5 times to if you have it enrolled. So they are persistent, where they're gonna help you to do that enrollment process, super easy. We have a number of groups that are on Prudent RX. Guess what our enrollment is? 100%, right? Nobody wants to pay that 30%. So again, if you have any questions, I'm gonna stick around and please ask me after. I'm happy to talk to you about this, but or anything that I'm covering. So value-added benefits. These are some of the great things that we offer to you. The first thing, if you were with us before, you're aware this benefit has not changed. The first annual colonoscopy, mammogram, Pap, or prostate exam is covered at 100%. We get one per benefit period, regardless if there's a diagnosis. Why is this important to you? I would say you go in for your first colonoscopy, and let's say they find polyps, and your doctor wants you to come back in a year or 2 years, depending on a recheck. Most likely, every colonoscopy you have ongoing will have a medical diagnosis. With the group health trust, you get one per benefit period paid at 100%. Other plan providers that be subject to deductible because it's no longer prevent. So thus it's a great benefit. We want you to go in. We want that early detection. With mammograms, we do cover 3D mammograms. And I will say you get one per benefit period. So I like to just point this out because we've had the question in the past that you go in for a mammogram, they need you to come back in 2 weeks, they need to retest, they see something. The second one would be subject to plan benefits. I just like to point that out. Vision exam, Ken will talk about the vision plan that's available that you may want to consider if you have the need for hardware, glasses, contacts. But with the group health trust, you get a vision exam, one per benefit period, paid at 100%. All covered family members on your plan, they're on the plan, they get access to this vision exam. We cover the refraction, and all vision providers are paid as a network. So that's a great benefit for you. Teledoc, I have a slide, so I'll go in a little bit more detail, but general medical, behavioral health, and dermatology is all available to you at no cost. Better health, I have a slide on that. Buddhist medicine, gut health, weight loss, and other great benefits of this plan that we're seeing is value add. Maternity management or maternity care, that's a program for expectant mothers. If you enroll within the first or second trimester, you can earn a $25 gift card for participating in maternity care. One Pass Select is a discounted health club membership, and they do have some food delivery. That's directly to you, but I'll talk a little bit more about that because I have a slide on it. The wellness gift card. I do want to mention that you do, I didn't mention yet, but you have the employer clinic. Please make sure that you're accessing services when appropriate, when you can, through that employer clinic. One, it's no cost to you. If you go and get your wellness exam at the employer clinic and you have them fill out the form for you, we'll reward you with a $50 gift card. So it's a great way where you're getting a no-cost exam, plus you need that exam for your premium contributions to help reduce your premium contributions. So it's like win-win-win to get that annual exam. So with us, again, wellness exam gift card if you have your wellness exam done at the employer clinic. And last is Kaya physical therapy. It's a virtual physical therapy. I have another slide on that, so I'll talk about that. So Teledoc, again, for general medical, behavioral health, and dermatology, all at no cost to you. The medical is available 24 hours a day, 7 days a week. And number of services they can, if you go in, like you have a science infection, call them up virtually. They can prescribe medicine and send that to your the local pharmacy. So it's a great service if you're just not feeling well and you need some help, you're trying to understand, do I need to go to the urgent care? So again, great service. If you're going to use Teledoc, I highly recommend that you download the app and you fill out the brief medical questionnaire so that you're ready to go when you need it. No one wants to monkey around with completing forms or whatever when you're not feeling well. So get that set up ahead of time. For behavioral health, there are different levels of providers. So either therapists or time grids. And one of the big benefits to Teladoc is that they can actually, for behavioral health, they can treat adolescents covered on the plan ages 13 to 18. We're seeing an increase in behavioral health needs in our adolescents. Post-COVID, more depression. So again, this is a great confidential, from the comfort of your own home, access to that care. Just know that this is available and it's a great benefit. And then again, dermatology as well. So that again, all those services through Teladoc is at no cost. So Better Health is a program that we added to the GHT. Select groups have it. It's not all of our groups have Better Health. But this is food as medicine or gut health. So it's a food elimination program where they kind of reduce what you're eating, eliminating processed foods, and slowly start adding feeds back into your diet. And you can see how your body reacts. We're seeing people lose a significant amount of weight on this program and get healthier. So it's not just a weight loss program, it truly is overall health. So we're seeing people reduce their cholesterol, high blood pressure, mental focus, inflammation. I was just doing a wellness fair recently. I had a member that started this program in July. And from July, in 2 months, lost 30 pounds on the program, dropped her cholesterol by 90 points. She was raving about it. We put about 19 groups on this program in January, and in April, when we ran the reports, we're over 6,000 pounds lost. So on the next slide, I just like to point this out. So the person in this, the female in this, her name is Anna. She's actually a GHT member. And so she piloted this program for me, or for GHT, and she inspired me because I got to do a call with her to learn more about the program. So I personally tried Better Health. And in July 2024, I started the program. I'm down over 50 pounds, and I did a triathlon in August. Thank you. I wouldn't have done it if I wouldn't have without Better Health. So I mean, 1/4 mile swim, 12-mile bike, and 2-mile run. So it was definitely within an Ironman. But I never would have done that before. I said I finished and I wasn't last. So that's kind of my joke. But anyway, just remarkable. This program is fantastic. The other thing I'll say is we pay for employee and covered spouses on the health plan to participate in Better Health. You get a scale, you work one-on-one with a coach for 5 sessions. And then you get AI app, it's access to recipes. They do a food delivery, that's on your own time if you want to do it. You do not need to purchase food from them, it's just a convenience. They do it like a co-op, we buy trays of food, it's a number of servings. We are going to do more information about this program, so we're already in the process of starting to plan for webinars in December. We'll send out an email to your HR team to forward that on to you, so watch for that. If you enroll through the webinars, we call it a skip the line, where you can actually enroll in December. That way you can get your coach, you can learn a little bit more about the program, and be set and ready to go in January. So I can't say enough about it. It's fun actually doing meetings where our members stop me and thank me for this program. It's just been fantastic. So, and I'm living about it. So maternity care, talked about that again. If you're expecting or planning on starting a family, you enroll within the first or second trimester. Easy way to get $25 gift card for participating in the program. A lot of great information that can help you in the pregnancy journey. Our goal is helping babies. One Pass Select. Again, this is just a direct to you access value added program where you can go to One Pass Select today if you belong to a health club and you want to see if there's any value to this. You can go to onepassselect.com, put in your zip code, how far you're willing to go, like 20-mile radius, or wherever you work out, and then it'll list the facilities that are participating, and it'll show what tier they're in. So, for example, some of the health clubs that we've seen participate, Anytime Fitness, Snap Fitness, Grizzlies. So there's like a number of different, a lot of like local one-off gyms. We've not really seen the YMCA is listed. But again, it's worth checking out if you do like a health club. Whatever tier you buy, you get access to all of the health clubs in it. So like, for example, the classic tier, if you enroll in the classic tier, it's not just one health club. You get to access all of the health clubs in that tier. Make sense? If you, there was one time I was looking, there was like a elite kickboxing gym in the Appleton area that was part of that $249 a month fee. But if you do enroll in something like that, because that's where you'd like to go, you get access to all of them. So it's whatever level and below. So again, just a nice resource, expanding your access. And then the other thing, they do meal delivery as well, and then they do have some online classes. It is an individual membership, so if you and family want that membership, they do discount it for multiple family members. You would just have to determine whether or not it's a better cost to you than having a family member directly with your gym. Again, this is directly on you. You can sign up once you get your ID card, because they will ask for your ID number to have access to that. So again, talked a little bit about the wellness incentive. This is the $50 card that for having your annual exam at the Fond du Lac County Care Clinic. Just to let you know that our process, since you guys were with us, you were with us before, we were able to get those gift cards out really quickly. We changed the process where we have UMR issue those for us, so it takes a little bit longer because they don't keep them on hand. We've just changed that process to administering them, so it will take a little bit when you send in that form. So don't call us a week later looking for your ID card. I promise you, it won't be ready. So just be aware of that. And then Kaya Virtual Physical Therapy, this is at no cost to you. If you'll look at the benefit summary, there is a limited number of PT, physical therapy, occupational therapy visits, a maximum of 40 per benefit period. So with Kaya, that's not restricted. And you have a $25 copay for therapy right now. With Kaya, it's no cost to you. Comfort of your home, you don't have to miss work trying to get in a therapy session. So again, just know that this is a fantastic, if you're in any muscular skeletal issues, this is a great resource for you. It's fantastic. Again, no cost. We're hearing a lot of positive feedback from another 2 counties really close to you that have access to virtual therapy. Their employees are raving about it just from a time and cost savings and good quality of having access to this stuff. So watch for your new ID cards. Again, like I said, for some reason you saved your old cards, go ahead and shred those now. We'll get you some new cards in the mail. You will have a sticker on, if you're enrolled in a family plan, you will have a sticker on the ID card that will say, please contact us to activate this card. Please contact them to activate your card. We're looking for coordination of benefits information for your dependents, for your family members. So if you have a spouse that has benefits through their employer, or you have a custodial situation where your child has other coverage through maybe an ex-spouse, please let us know anything, Medicare, Medicaid, any other coverage, so that we can determine who is primary on the list. If you do not let us know, your claims will pend until we get that information. So again, we need that information in order to process claims in order. I worked in health benefits my entire adult career. This is not something new. We've done that the entire. We always need to know who's primary on those claims. Again, you'll get 2 cards, and then if you need additional cards, just reach out to UMR, or you can order them yourself through the portal. And then the other thing I want to say is make sure you show your new ID cards to your pharmacy and to your doctors. Because otherwise, that's one of the other problems that we get is you're going to call up and say, hey, they're denying my claim. Because they're going, yeah. So we need you to make sure that you're showing your ID card specifically at the pharmacy, but then also at your doctors to make sure that they're billing that correctly the first time. So here's the information to access us if you need questions now. We want to make this a smooth transition. So if you need help finding a doctor, you're having troubles locating your physician and you're with the search, we're more than happy to help you. If you have a question about a benefit, or you know already you have an upcoming surgery, maybe January 15th, please reach out to us. If you're currently in medical care for some medical situation, we're happy to help you. So as you can see, like the physician matches the physician down at the bottom, so you're gonna reach out to us at the GHT inbox at charlestaylor.com. So again, any questions that you have, we're happy to help. And then you see the prescription bottle matching the prescription bottle, so if you have a question on wondering what tier your medication is on, or if your medication requires an authorization, or any unique situation with that, please reach out to us. It's funny because I was talking, I call him my drug guy, but he's really our pharmacy contact. He said, don't call him my drug guy, but it's our prescription guy. Anyway, he said, I haven't received questions from Fonda like that. Yeah, so we're just doing snap. So I expect his email to be lighting up now with questions, but again, we want to answer those questions now. If you're on a medication and you need to understand how that's going to process, we want to answer those questions now rather than have you frustrated on January 2nd or January 3rd. So the GHT, we have a team, again, your day-to-day customer service will be with UMR when the plan is active, but if you have any escalated issues or concerns, their access through USI, they have I just blanked the name.
BRT,
Benefits Resource Access Center that is able to help you, but if you have a question, your HR team can escalate those questions to us as well. So we're more than happy to help you. We want to make you happy that you're back with GHT. And again, we're thrilled you're back and welcome. And I'll turn it over to Ken, but I'm going to stick around if you have any one-on-one questions. Yeah.
Perfect, thank you. So that's the highlight and the overview of the medical benefits. I'm gonna go through some of the ancillary lines, the dental, vision, et cetera. But do want to put out in front of you the rates. So as we went through the renewal process, with Anthem, it became apparent that we needed to make a move based on benefits and costs. So it did come with a slight increase. So a lot of those value adds, those are great, but there's a slight 3.5% increase to the premium rates. That's an extremely competitive rate. Medical trend is running much higher than that. There's a lot of employers out there and employees that would love to see a number like 3.5% in terms of an increase, especially with the benefits you have. But you can see the renewal rate for with wellness, without wellness. And you can see what the county pays and the employee pays based on that 15% and 18%. So this is dependent on whether or not you had your physical as the staff member at the employer clinic. New coming up for having to have it completed in 2026 or 2027 rates would be both the covered member and the spouse getting annual physical preventative exam done in order to qualify for the benefit reduction. All right. Okay, so moving on, employee benefits, EDC, they provide the FSA account, will continue to. You have both sides of the flexible spending account. So the healthcare FSA, which has a maximum of $3,400 for 2026. And then the dependent care FSA, which has a maximum of $7,500. So for the first time in years, if anyone's access to the dependent care, it's at $5,000 for as long as I can remember. That has now increased to $7,500. Couple things to keep in mind on the healthcare FSA, you have a 2.5 month grace period, which means anything that you do not spend that you've elected in the plan year, you have 2.5 months into the following plan year, and the dates are there. So you have until the middle of March of 2026 to submit claims for the 2025 year. If you still have money in your FSA after that point, it does forfeit. So keep that in mind when you're making new elections, or take a look at your balance now and see if there's anything you may be able to submit for reimbursement. On the healthcare side, if you have utilized it before, you're aware that whatever election you make is available to you on the first day of the plan year. So if I elect $3,400, the maximum to go into my FSA, on day one of the plan year, that money is available to me to get reimbursed, even though it may come out of my paycheck over the 26 pay periods, okay? On the dependent care, it's the opposite. So on the dependent care, it is only what has been taken out of your paycheck on a payroll basis and what is in that account that you can get reimbursed for. So if you try to submit for, $7,500 in the second month, it's likely not going to happen because you will only have 2 months of that contributed. So some people wait for the quarter or 6 months or the end of the year to submit for the full amount. Delta Dental providing the voluntary dental insurance. You can see there was a slight increase here as well, 5% due to some utilization. Breaks down the employee, employee spouse, employee child, and the family rates. The benefit maximum is $1,000. That does not include diagnostic and preventative services. So, you know, those annual cleanings, preventative exams, the fluoride treatments, x-rays, etc. Those are provided at 100% and they do not count towards that $1,000 maximum. So, you know, don't hesitate to go and get those services handled if you have elected the voluntary dental. And it does have $1,000 per cover dependent child up to age 19 on the orthodontist. So take advantage of that if you need to get braces for a dependent. Voluntary LTD, so long-term disability, that received a rate increase as well. This is a small dollar amount, so it's not that impactful, but it did go up by 12%. It was higher than that. We did some negotiating to get it down to 12, but you can see here some examples based on the age band, the monthly income, and whether you're on a 30 or 90-day plan, what the cost is. So you can see the current cost and then what that increased cost would be. It's fairly minimal at this point. Couple things to note. If you haven't elected LTD before and you wish to, you will do that through the Oracle enrollment. So you will have to fill out the application form and then you will submit that to Prudential. Do not contact HR and provide that. However, for anything else, whether you're changing an election or you're dropping the disability, you can contact Marion HR for that. And that can be handled. Otherwise, when you go through the enrollment, if you're looking to apply, you would do that in the Oracle system. Vision insurance is provided as well. Now, Trina mentioned that there is an annual exam, vision exam covered through the medical plan, which is a great value add. So for those of you in the medical plan, if you want to take advantage of a materials only program, you can do that through NBA. You can see the cost down in the lower left there, but that would be for, you know, eyeglasses, contacts, etc. You can do a materials only plan. For those of you that maybe aren't on the medical plan, so you do not get that eye exam benefit, you can buy a full service vision plan through NVA as well, and you can see where those rates are. It's a national provider. I think there's 100,000 facilities in the country that are in network with NVA to be able to access the benefit. Last, another value add. This is new this year. It's called Benefit Hub. They've been around for a while, but they're just an online mall where there's just volume discounts provided on certain things. There's no requirement you use this, but you know what, if you're gonna go buy a new TV at Best Buy, or you're gonna look to get a rental car for a trip, or you're looking for hotel discounts, I mean, there's sites all over the place that can help you with this, but this is one accessible to you because you're an employee here. So scan the QR code, log in, take a look and shop around for anything, like I said, from, you know, trips to shopping for computers to rental cars, whatever it may be. Pass this along to a spouse, grandma and grandpa. I mean, there's really anyone can access it, to be honest, if it's coming from you with that QR code. So, all right, with that, I will hand it over to Mary to talk about the Oracle enrollment.
All right, the main things I need everybody to hear and be aware of. No benefits that are being offered now are going to be carried over. The ones that are in Oracle. Everything is waived except, of course, your disability and your life insurance and your Wisconsin retirement. So everything else is waived. If you do nothing, everything will be waived. So please go in and decide what you want, because November 1st, I can't help you. So you are responsible to do that yourself. Another thing I want everybody to know is if you have Anthem now, use your Sydney points. So go get your gift card. So go into your app, see if there's any money left in there and use that money. Get a gift card. I would go in there now, spend the money, you know, put it into a gift card, and then go back in December 31st or December 22nd or something and make sure that there's no money left. Because we won't be able to get that money back come January 1st. So that would be in your Sydney app if you have it in. That'll make sense. Okay. Another thing is you cannot change your Mission Square during open enrollment. So Mission Square is frozen until November 1st. So you can't make any changes to it. If something is imperative that you have to stop your plan, or if you're putting in a ton of hours and you really need that money to go into Mission Square, you'll have to reach out to me and I'm gonna have to wait through administration. So just keep in mind, Mission Square is status quo. So if you had it coming out, it's still gonna come out. And it's gonna be that same. Another big one, okay, wellness cleared and wellness not cleared. Whatever you had for this year, for 2025. When you go through open enrollment, it will be the same. Just because we don't know, and we won't know if you are cleared or not cleared until the end of November. Since you still can get a physical until October 31st, we don't know who's had physicals and who hasn't. So the easiest way that we didn't have to go through the whole county is to just move it forward from this past year, 2025. We will get that all corrected by the time you see your premium for January of 26. So the ways you can see if you had that physical, if you didn't go to the clinic. If you go to the clinic, I guarantee you, Jenny's gonna send me that list. It's gonna be correct. It will be fine. Anthem, go to that Anthem app, that Sydney app, and see if physical was marked off that you got $25 for. If it wasn't, and you know you did, you have to work that out with Anthem. I can't help you with that either. So just keep those things in mind. So it started November 1st of 2024 until this October 31st for your 2026 rates. And that's employee only for that physical. For 2027, it is going to start November 1st of 2025 until October 31st of 2026 for the 2027 health insurance rates. So please keep that in mind. Please don't panic. If you're a new employee and it's still at 18% and you know you took that physical, please be patient. We will take care of it as soon as we get those lists, but those lists won't come in until the end of November. All right.
Hey, Mary,
Yes,
just to confirm, this year for next year. Next year as employee and.
correct. 2026 rates are just employee, 2027 employee and spouse. Okay. Reminder that express care, convenient care is free on the weekends. And only weekends. So besides having the clinic, which is Monday, Tuesday, Wednesday, Friday, you could go on Saturday and Sunday to convenient care, express care for free. If you do get a bill, then let me know and we'll get that corrected for you. Then let's talk about Oracle and what you're going to do for open enrollment. So we did write step-by-step down on this yellow piece of paper, but we have a fancy little video that we're gonna show you too.
Yeah, I might. I don't know.
It's okay. I'll try. IT's in the room at least, so if we get stuck. That's one
Okay.
person.
Yep. Oh, I gotta sit down. Yeah. All right. So you're gonna go to your Me tab. You're gonna see your name. Then you're gonna go down to the benefits. It's that nice little package because benefits is a gift. Especially in the Oracle world. Then you're gonna go to enroll now. You're gonna click on that.
And then you can get to know your benefits. There's different packets behind it to read more information. A very important thing is verify who you want to cover. So if a family member is not added that needs to have coverage, you need to add it here. The main things that you need to know, first of all, legal names is very important. The other thing is you need a date of birth and you need a social security number. The other thing is the relationship cannot be before you started to work here. So if you have been working here 10 years, but your son is 15, you're going to put that first day of work here. And it will auto-populate if you don't put the right date in. So you don't have to worry too much about that. One of the main things too is that social security number is scrolling down to the end, which he's going to get to right now. It's called the national identifier. That is where you put your social security number for that person that you're adding. That needs to be in there to push that through. And after you go and add it, you're always confirming to push everything through continue and make sure everybody's listed. And then you'll go into enroll in benefits that matter to you. All right. So because it's so big, he had to put it on 2. So you're going to enroll. You're going to go on to that edit your benefits or enroll. First time it'll say enroll. If you go back, it will say edit. You will hit continue. We also have that USI app. That is a really good idea to download so you could put your insurance cards on it and have access to that information at your fingertips. So Josh went down and he enrolled just in single plan for everything, but you can see how simple it is to pick that, what you want to enroll in, what your premium is, and you get to select whatever you want. So he's going down to the vision. Everything, you have to decide what you want to do and then hit continue. This is that disability portion. It'll say if you have disability or not. If you do want to apply for coverage and don't have it now, there's that evidence of insurability that you would have to print out the form, send it into Prudential to make sure that they will decide if they want you or not. And they will let you know. Life insurance, this is what you have for coverage for life insurance. So you know what you have. If you wanted additional coverage, you would again have to apply for it through Securin. They would decide if they were going to take you or not. Flexible spending too, you have to unenroll because everything is first wave. So just so you know that just a second when I get through this. Because it goes a little fast. Wisconsin retirement you can't get out of, EAP you can't get out of. Those are things that are in the plan. You're going to make sure all the train stops with the check marks at the end are checked. And then you're going to hit submit. Then you can go over and view your enrollments. Very important. You can view those enrollments to know what you have chosen. If you print that report, it will print a wonderful report that says what you had for 2025 and what you enrolled in for 2026. So it's a little tricky. So the first time we saw it, we were like, oh, what's that? But it's really nice. So then you don't have to ask what you are enrolled in, you know what you have. We suggest print out that copy so that you have it. One thing with open enrollment is you can do this every day up until October 31st. So if you have something in mind and then your spouse comes home and says, hey, I just have this great and change plan. So you compare the two and you're like, yeah, I don't want mine, I want his, or vice versa. You can do that all the way up until October 31st. So, but what you have done October 31st is in stone unless you have some kind of status change. You have a baby, you get married, you get divorced. Those are the times that you could change it. Other than that, your spouse loses a job or gains a job. Those are all events that we can change those coverages to. And for help, okay, so if you need Oracle help, and I'm not saying getting into Oracle because that's an IT thing. So if you can't get into Oracle, you'll have to email the Oracle support to help you get in. HR cannot help you with that. If you need help applying, updating your coverage, you have questions on that, then Holly and then Josh in the county exec's office, those two can help you with that. So that enrollment piece. If you have questions like on a status change, or you have a particular situation going on that you need to talk to myself or Brooke, the two of us can help you with the more complicated benefit questions that are particular to you. So just so you know that there is help out there, and I'm not the only person who can help you. We do have a team, so that's important to know. And with that, anybody have any questions of any of us?